like a test that I fail, so depressed when I can't seem to get.
Now, welcome all. As you know, we are moving on the 14th day of our this webinar of the traditional science energy medicine. And today the topic is the Raktamokshana, and it's a great privilege for us that we have Dr.Priyanka Ganguly, who is the Assistant Professor of the Rajiv Gandhi Ayurvedic Medical College, West Bengal, especially in the Department of the Surgery of the Ayurveda, and she is the PhD scholar, and she is the renowned Ayurvedic physician as well as surgeon. She is working on the cosmetic correction with the Ayurveda and the other traditional or the Ayurvedic therapies. So today she will talk on the Raktamokshana. So already she is with us, and it's an honor to have her. And so I request Assistant Professor Dr. Priyanka Ganguly to deliver her lectures and enlighten us. So please, Dr. Ganguly.
Thank you, sir. Thank you.
Please start now. You may start. Oh, you need to share.
Yes, I want to share.
You need to share.
Yes, I'm not PPT, so just I want to share. So just give me one permission because it's showing
Yes.
disabled participants. Yeah, screen sharing.
Already they have been given screen sharing. You can screen share. Yeah.
Okay. Thank you, sir. Thank you.
Welcome.
Is it visible?
Yes. It's visible, audible, both.
Okay. Thank you, sir. So, good morning, everybody. Today I'm going to start to present my topic. But before starting my presentation, I want to give special thanks to PARVATHI VIDYAPEETH and our principal, sir, Taposh Kumar Mandal, sir, because both of them have invited me to present in this platform, this special platform. So I'm very much grateful towards all of them. So before starting my topic, I'm just going to show you one video clips. Yes, this is very famous movie. I think so many people already watched this movie. That is Karate Kid. There's showing a small kid is getting treated by his trainer by the help of the cupping system. And actually this procedure was very ancient procedure, but still now it's becoming so much familiar as well as very much popular even in whole worldwide. So that's why just today my topic, I have concentrated over this topic, that is Raktamokshana and cupping for body and mind. I'm Dr. Priyanka Ganguly, Assistant Professor of Shalatantra Department in BSRG MSCH, West Bengal under Techno Group, as well as PhD scholar in Parvati University. Now coming to the first point, that is the Raktamokshana. Yes, this is the word Raktamokshana is the actually combination word. Two words is there, Rakta and Mokshan. Rakta means we are knowing that is the blood, yes, and mokshan means to let out or to remove or to drain out, right? So what happened? We are knowing that Rakta is actually Jivana, okay, actually giving us Jivan or Prana. Then why should we be removing out? Actually, Acharya Asst.Prof, he has explained that in our body there is having three doshas. We are knowing that is Vayu, Pitta and Kapha. But besides that also, sometimes Rakta, when it is becoming impurified or vitiated, that time it's also acting as like the dosha. Okay, it's also leading different kind of disorder in our body. Like they are having several disorder, Vata, Rakta, Pitta, etc. Several. So that's why Acharya Asst.Prof has mentioned that whenever the rakta getting vitiated and it is also polluting our whole body and mind, that time is required to removing out or draining out from our body, because it's also acting as like the chaturtha dosha, right? Now coming to the point, that is other acharyas like Bhagavata and as well as Shusruta all described, all illustrated that actually this Raktamokshana is one of the part of Shodhana karma or purificatory procedures, because it's purifying our entire blood streams as well as it is cleansing our body and mind. So just becoming well-being, that's for that one, we have to go for the Shodhana karma. And that is also under this Raktamokshana. There's also under Raktamokshana is belonging. Okay. Now the history of the bloodletting or the Raktamokshana. Actually, we are thinking it's only practicing in India only, but it's not true. Even in the whole worldwide, it was practicing since ancient time. It has been seen here that 1550 BC, we are getting the first evidence of the practicing of Raktamokshana or bloodletting in Egypt. Their papyrus, Edier's papyrus, the entire procedures had been illustrated nicely. Afterwards, we are also getting several evidence in Greece as well as even in Middle East also. And there's also, I have collected some pictures that's also showing that 1517 BC, even 1860 AD, sorry, these are the AD, even 1310 to the several years, it's also practicing. And not only that, they have drawn all the points where we should apply the cupping or some Raktamokshana points for the Shiraveda and all. Everything has been illustrated there. Most of the cases, the cupping therapists were to do. So everything has been illustrated. But the matter is, some other countries, they have given some different name. In India, it was just Raktamokshana or Shira, this Sringavacharana, Olabu or Ghati. But in case of Middle East, they have given hijama therapy, just like that name. In other countries, they have given the traditional cupping therapy. Like that, different names are there. Even venipuncture and bloodletting, some different names are there. But most of the cases, the main mechanisms and principles are same. In India, also 600 BC, we have seen it that Acharya Shusruta, he had illustrated the entire Raktamokshana procedures vividly in Shustra Shangita, Sutrasthana 13th and 14th chapter, along with the Sharisthana also. Okay, and now I'm coming to the importance of the Raktamokshana. Okay, why we should go for the Raktamokshana? Actually, it has been told here that Raktamokshana is actually the Ardha Chikitsa, like that, just like the Basti. Any treatment, if we are giving along with the Basti karma, as like the Panchakarma, in case that we have seen here the Ardha Chikitsa already done. Same like Raktamokshana, if we are also providing for the patient, that's also working as the same line. Okay, so it has been told yet in case of Tagdosha Granthayaha Shofa Rogaha Sanitaja Ascha Ye Raktamokshana Shilanang Bhavanti Kadachana. So, in case of any kind of skin diseases, any kind of glandular swelling and all, any kind of idiomatous conditions, if we are going for, even not only that, even Sanitaja means any blood related problems, okay, any kind of disorder and all, if the person is taking the Raktamokshana in periodical, it has been told yet that 6 months one sitting should be taken. If the healthy persons also like that, for them also it has been recommended. Like that, the same concept also in modern era also recommending that you should give the blood donate. This blood donation, this concept also actually came from this Raktamokshana concept, because there's also it has been told yet by your blood donations, usually again new blood cells will form along with all the tissues also getting promoted. and blood circulation is also getting increased. So that's why it's also helping to get good health. Okay. So now coming to the principle of the Raktamokshana. Okay, so usually whenever we are performing any Raktamokshana, that time we have to follow some principles, and this principle based on our three doshas, mainly our three doshas, Vayu, Pitta, Kapha. Okay, so it has been seen here that Tatra Vata Pitta Kapha Dushta Sani Tanyatha Sankham Sringa Jaloka Labo Bhiravabhushacha. Means actually in case of the Vayu, when it is aggravated, that time we are giving Sringa, we are using the Sringa for Rakta Abhushejan. Why? Because whenever we are going to treat any Vayu aggravated patients or same like conditions, that time we have to give some opposite characteristic material. So it has been seen here, Sringas, its property is actually next sloka, that is the Ushna Sha Madhuram Snigdham Gaba Sringa Prakirtitam, means it's having entirely opposite character of the Vayu. That's why just to eliminating or just making it, equilibrium conditions, that's why we are using in case of the Vayu. This is for Sringa. Next one is the Pitta. In case of the Pitta, we are using Jaloka. Why? Because Shita Odhibhashya Madhura Jaloka Bari Sambhava. Because usually Jaloka or the leeches are residing in the water, and their entire characteristic, if we are going through that, we will see it's Madhura and very cold potency. They are having cold potency. So we are knowing Pitta, whatever the characteristic, it's entirely opposite. So just to reducing or just making it equilibrium condition, that's why we are using leeches in case of Pitta Dushita. It's the same like Kapha. That's it has been seen at the Alabu. Alabu is having what? The sloka also there, Katukam Ruksham Tishnam Ja Prakirtitam. Alabu is Katu. Pungent is there, Ruksha is there, Tishna is there, which is entirely opposite of Kapha. So in case of the Kapha related cases also, we are applying the Alabu. Okay, Kapha means any stagnation is there, any kind of lack of the blood circulations and all. In that cases, definitely we are applying Alabu. So, mode of the action of Raktamokshana. It has been said why should we apply, how it's working actually. It has been seen it actually two matters occurring in case of any kind of diseases. Okay, most of the cases when any Rakta related or blood related disorder, usually the blood first becoming vitiated first of all. Second one is the Vata, that's also causing the avaran. Avaran means the obstructions, entirely obstructions over that area. So first we are going to take some modalities which will remove blockage of the avaran. Okay, then what happened? Usually Vayu again starting to work normally. It's entire the normal functions again established. The same like whenever we are giving any Raktamokshana, okay, or removing the blood, okay, whatever, same like. Then and there, the avaran getting breaking down and normally blood starting to work. Not only that, even it's along with that, the Dushita Rakta, that's also getting purified. How? Because the next one is that in case of blood circulation, which also getting stagnated, whenever we are removing the stagnated blood out, then and there, the normal flow of the blood again started to be naturally flowing. Naturally, the flow will bring back. Okay, so that's why the Kandara, Shira, Mangsha, Snayu, okay, everything becoming energized. Okay, again, they are getting the proper nutritions along with the blood, and the circulations becoming normal, and then and there, the problem also getting subsided. Now, coming to the indications and contraindications. Yeah, Raktamokshana is having different indications like Vidradhi, any kind of skin diseases, Kushtha, okay, any kind of Ekodashaja Sofa. Yes, that is the very important matter. Any kind of Shofa we could not go for Raktamokshana, because if there is having 2 or more than 3 doshas involvement, usually we are avoiding Okay, if it's not only that, even Sharvanga Shofa also is there. That time also we are not going for Raktamokshana. Why? Because so many times it has been seen here, the persons who is having anemic conditions also, for them also it is very much common feature of this sofa or swelling of this pedal shape. So swelling is very common factors. Not only that, sometimes their body is having a little bit the sofa tendency. Okay, if a person already anemic or Pandu Dasha already presenting, if we are going for that, it will produce some kind of severe complications, and also we are actually avoiding in case of Shofa cases. But Ekodasha Sofa we may treat, okay, along with any sleepada paralysis cases, Bisharpa cases, or ACP-less, okay, along with Arbuda or any kind of carcinogenic tumors, whatever is present in there, that we may apply. Not only that, even Granthi, Shudraroga, Upadansha also we may go for that. But contraindication, that's also, it has been told yet that the person who is already weak, okay, already like any after post-surgical cases, there's also it's not being recommended, because after surgery the patient is also becoming weak. Not only any children, for any aged person, okay, usually we are avoiding, along with any Udara, Shoshak, Liba, Paksha, Khata, sometimes. But there's also having some exception also, okay, some exception also there. Sometimes we may apply other procedures, but in generally we are just having this list. Next, coming to the types of the Raktamokshana. Yeah, so we already knowing that there is having different types of Raktamokshana, like Sringavacharana, Jalokavacharana, Shira Veda. We are using the Abu, Ghati, and Prachana Karma. So all those procedures actually we have categorized. Excuse me. Okay.
Please continue. Please continue.
Yeah, so we are just categorized in two heading, that is the Shastra, another one is the Ashastra. That means whenever we are performing any Raktamokshana along with any sharp instruments or Shastra, usually under that some procedures are there, like Prachana Karma, Shira Veda, Shira Veda and all. In case of the Ashastra Karma, usually Jalokavachana, Sringa, Alabu, and Ghati Yantra usually we are using. Now today actually we are going to concentrate over the cupping therapy, because it's a vast chapter. So first I am completing this one. If I'm getting the rest of the time, then definitely I'll be covering the rest types of the Raktamokshana. So first I'm going to start this one, that is the cupping for body and mind. Okay. So what is the cupping therapy? Yes, usually it has been seen that cupping means several types of cups usually placed over the skin layers, okay, just to applying the mechanisms, suction mechanisms, which is actually creating the vacuum, okay, inside this cup and the skin layers, okay, in between, which is actually raising the skin, and then and there what happened, enter the blood circulations over that area becoming increased. Not only that, a person who is already having some chronic or acute type of pain, okay, even having some inflammations and all, even it has been seen yet that in case of any psychological problems like depressions, like anxiety, even other like insomnia, like that, stress, tension, everything, it's also getting improved, because whenever the blood circulation is getting increased, along with the lymphatic channels, their circulation is also getting increased, as well as it has been seen at the other organs, those are also getting the proper stimulations. Then that all the glands also secreting the proper hormones. So that's why it's also affecting, hormones also getting affecting. So what happened is also helping to balancing those hormones secretion. So it is helping for our psychological disorders. Same like the history also we are getting first in Egypt, okay, same like the 1550 BC, and as well as the China and Middle East, that's also we have got several evidences. Especially in China, they are having the special procedures, that is traditional procedure, that is the traditional Chinese medicine. There they have actually described 365 points where should be applied the cupping therapy, which usually related to the nerve endings, especially the nerve endings. And the chi is the vital energy. They have shown that this chi or the vital energy also getting increased, as well as yin and yang. Yin is actually the negative power or negative energy. Yang is the positive energy. So both energy getting in the equilibrium conditions. Afterwards, in Middle East, I mean the Iran, then Iraq, Turkey, those areas, then even the Arabs or Saudi Arabs and all, those areas also, they are practicing the same therapy, but in some other name, that is the hijama therapy and all. Okay. Now in India also the same thing, Acharya Shushruta has explained the cupping therapy in some other name like Sringavacharana, Alabu, and next one is the Ghati Yantra. Actually, those three is having the same mechanism, just to making some, creating some vacuum, which is actually helping to, this is depending upon the mechanism of the suction mechanisms, and based on that, usually the blood is sucking, blood is just removing or draining out. So in our science also, Sringa, regarding the Sringa, Labu, Ghati, it has been explained that Tatra Prachite Tanubasti Patalapalthena means, usually Tatra Prachite means at first Prachana Karma. It is actually recommended for Sringa actually, that first the Prachana Karma or the incision should be given over the skin, and afterwards the stringer or this horn should be placed over that area, and usually the narrow orifice should be kept by the physician, okay, and over that Tanubasti means very lean or thin type of cotton should be kept over that, and that time they have to suck, okay. So actually this length of this Gavasringa usually 18 angulis, that is 36 centimeters. So it is very long. So there is no chance to, introducing this vitiated blood to inside the physician's mouth. Okay. So it's very good. First one. Second one is the Alabu and Ghati. For the Alabu and Ghati, and usually what that is the picture board, that inside there the burning lamp should be kept. So what happened then, and that the entire air becoming expand, and then and that this area becoming entirely air free. So then and there we have to keep over the skin areas where we want to apply. So what happened? Empty area. So automatic this vacuum creating these actions mechanisms. Due to that, the blood started to coming out, or sometimes not only blood, sometimes these areas also, these skin layers also getting elevated. So then under the blood circulation getting increased. Okay. So same like in modern science also what they are doing, not modern science, no, modern cupping therapy, what they are doing, the alcohol dipped, any cotton, they are dipping inside the alcohol, and afterwards, after making the tablets, then and there, they are holding by the artery fossa, and then just very fast, they are moving inside the cup. And then and that, this cup, they are just covering over the the affected area where they are going to treat. Here also the same thing I have shown yet, the same thing they are doing like that. Okay. So now coming to the next one, that is modifications of the Alabu, Ghati Yantra, Sringa. So usually nowadays the classical Sringa, most of the cases people not that much using. Sometimes they are using, and by replacing optic fiber tube also already came in market. And as well as the same mechanism, they also apply to produce some other different machineries like the suction, the brace pump and all. Those are having the same mechanisms. The same mechanism also applying there. In case of the Sringa also, there is having different pumping machines that also can be connected with the horn, and we may apply this video I'll be showing afterwards. And this is also nowadays what happened, they just replacing this horn and the bamboo cupping set. Nowadays the fiber cup came in, along with sometimes they are also making by the silicon also. By the using of the silicon, there is a very good benefit that it during this procedures it may move from one side to another side. So in that time, patients also feeling little bit massage like feeling. So what happened, it's also helping to do the deep tissue massage along with this cupping therapy. Now coming to the types of the cupping therapy. Yes, there is having several types. The mostly we have classified is wet and dry cupping. Usually in case of the dry cupping, there is no record of any giving any incision or prachana karma. Okay. This kind of cupping therapy we may correlate with our Shastra Raktamokshana karma. Okay. Here actually just making these elevations 3 minutes to maximum 7 minutes we have to wait. Most of the cases we are waiting up to the 3 minutes. Okay. And afterwards, slowly we adjust the removing. Okay. And then again, we are not giving any sitting over the same place. We have to give some other place. And after 3-4 days, then we may repeat the same procedure. Okay. And it has been seen here that it is very much helpful for any acute kind of pain. Okay. And not only that, even in case of the wet cupping, there at first we are giving some prachana karma, and afterwards we are putting this cup over there, and afterwards by suction, if it is required, we may apply. There's the third one, it has been shown here, that is the vacuum. Just suction apparatus, like we are just helping to removing out the blood from that. Okay. So based on some other points, based on some other categories also, we may classify that one, like the technical types, there is having dry cupping, flash cupping, wet cupping, massage cupping, like even related to some there actually what is the power, how much it is, is intensity. Based on that also we may classify it, like light cupping, medium cupping, strong cupping, like that. Okay. And suction therapy is related also, we may make it fire cupping, manual cupping, several are there, but most of the cases usually we are applying the dry cupping and the wet cupping. But nowadays then another cupping already came in. Still the research work is going on, so might be it will be available very soon. The laser cupping, that is also very much effective, is going to be effective, we hope so. Let's see, that is the based on the cupping sets, what kind of cupping sets are using, that is plastic cupping set, glass cupping set, rubber cupping sets, metal cupping. Based on that some categories are there, but nowadays rubber cupping sets and usually the fiber cupping or the basically the glass cupping sets or plastic cupping sets are becoming very much popular. And in case of the deep tissues massaging and all, usually the silicone based cupping sets are good. Okay, so now coming to the next one, that is the different kind of cupping set. Yes, that I already told that bamboo cupping sets now become a little bit obsolete because they are having several options. So this glasses, the rubbers, okay, plastics became nowadays little bit familiar with the physician. Now they're coming to the mode of the action. Usually what happened whenever we are applying this Raktamokshana, when we are doing Raktamokshana with the help of the cupping therapy, usually on that area, it has been told that any stagnation, when any problem is occurring, there any diseases or any disorder, the main cause is the stagnations. Okay, might be the blood getting the blood getting obstructed or lack of the blood circulations. Second one is there, I already explained, Vata Avrodh is occurring. So just whenever we are applying this kind of cupping therapy, then the blood circulations over that exact area becoming increased. Okay, if any stagnations also still leading some other problem, that time we are also going for the prachana karma, that is also helping to removing out or draining out the blood. So what happened, again new generations of the new generate of the blood is occurring, as well as circulations also getting normalized, as well as the lymphatic channels, their secretions also becoming proper. So when a person's already having the proper circulations of the blood and lymphatic channels, then their immunity also becoming boost up. So cupping therapy along with that immunity also helping to boost, as well as all the glandular secretions like the hormone secretions, even body fluid secretions, everything becoming proper. Not only that, even other organs, whatever the organs are there, that's also getting stimulated. Here also I have shown you that whenever the blood circulations becoming proper, then there what happened by doing this cupping therapy, then there all the extremities, head to toe, everywhere this blood is pumping just by not automatic. We are giving this pressure, then automatically this blood is going towards the extremities. So if there is having any obstruction, it's also becoming removed, right? Now, cupping therapy points for trunk portions. Yes, they are having several points. Actually, these points has been determined at first by the China. Okay, by Chinese people, because there is 365 points for acupuncture therapy. Okay, that is actually the most of the cases, that is the nerve endings point. So usually nerve endings points, as well as they also applying Ashi points. Ashi points means local pain points. The person came and then just exactly this area I'm having pain. Not they are telling some exact point, just a sudden local pain is arising, so he is just complaining like that. Based on that, some points they have selected. Okay, so over there they are applying the cupping therapy. But in case of the Ayurvedic physician, when we are going for the cupping therapy, that time we have to be little bit cautious, because in our science also there has been told yet regarding the marma points. Okay, so those marma points also we have to keep avoid, because sometimes Rujakara marma is there, Kalanta Pranahara marma is there. So we should not penetrate any those areas, or we should not hurt these areas, okay, during these procedures. Other cupping therapy points also there in case of the face, neck, and the extremities. Those are also very good for any kind of Barger disease, any kind of Raynaud's disease. Okay, so in that cases for the extremities, usually we are going for. Not only that, even for the trunk portions, also any kind of digestive problem, of any having person having constipation, the habitual constipation. In that cases, also for the dry cupping is also working very nicely. So not only that, even in case of the lumbar spondylosis and all that, I'll be explaining in case of the benefit slide. Okay. So otherwise, some persons having migraine, headache, that also those points already explained, where we have to go for this cupping therapy. Next one, coming to the benefit. Yes. Benefit that I have told you, that they are having the points which is the nerve ending is related to the exact organs, okay, like lungs, then kidneys, urinary bladder, spleen, intestine, okay, stomach. So whenever we are doing, this dry cupping or weight cupping. Most of the cases for the trunk areas, we are actually avoiding to do, especially, I mean, not the trunk area, the chest and abdomen portions. Most of the cases we are avoiding the weight cupping. We are usually performing the dry cupping. Okay, that's also increasing the blood circulation much more. Along with it is stimulating the intestine, stomach, and spleen, etc. organs, as well as the lungs and all. So to energize those, okay. Next one is the relieving the pain. In case of any kind of painful condition, it's working very nicely. In case of cervical spondylosis, lumbar spondylosis, lumbago, or sciatica cases, okay. In case of tennis elbow, even in case of carpal tunnel syndrome, neck pain, shoulder pain, okay, muscular pain, is working very good because it has been seen in the cupping therapy, not only stimulating those areas as well as it's also helping to generate new tissues, okay, new tendons, new tissues. So it's also helping to in case of any kind of degenerative conditions also. That's why in case of the osteoarthritis, any kind of rheumatoid arthritis also, we can go for the cupping therapy. It's also reducing the pain, it's reducing the inflammations, as well as if there is having any chance of degenerative problems, that's also it is helping to again relieve. Now coming to the lungs. In case of the lungs also, it has been seen it's also helping to dilatation. Dilatation is becoming also proper. That's why bronchial asthma, in case of the person who is already having the prone towards the cold allergy and all, and very much they are suffering from fever, flu, okay, and sometimes cough, cold is a very common for them. If they are taking this cupping therapy periodically, okay, weekly once or like that, some periods would be there. Based on that, they are taking. Usually, it has been seen here their bronchial place is also getting stimulated. Okay, and in case of cardiac cases, also it's working nicely because usually blood circulation increase. Not only that, blood letting also, I mean, by this cupping therapy, I mean, weight cupping therapy, we are also reducing the blood pressure also. The high blood pressure patient, if they are treating by the weight cupping therapy, they are also getting benefited. They are also becoming benefited. Even it has been seen in the before 1930 years. That's also it has been seen at that time congestive heart failure. These conditions also was treating by this cupping therapy. But afterwards, some other procedures came here. So these procedures became now a little bit unfamiliar towards a person, I mean other person. But still now it can be applied in case of cardiac problems along with the high blood pressure patient. Now coming to the next one, that is for the headache and migraine. That's also very good for them. Most of the cases it has been seen in the Bayu Prokave. According to Ayurveda, if we are going through that, most of the cases the Bayu getting Aborodha, and as well as there is having some other, sometimes Kapha also getting aggravated. So it is actually causing this kind of pain and all. So just to make it normalized, for that also cupping is very good options. Okay. And in case of the chronic fatigue syndrome, the person become very much fatigued. Okay, so in that cases, what happened? Actually, the obstructions occurring, lack of the blood circulations, lack of the lymphatic channels and all. So whenever they are taking this cupping therapy, then that automatic the blood circulation getting aggravated, the person's becoming energized, their kinetic energy again re-established. In case of the anxiety, depression, stress, that's also for the mind also cupping is having very good results, especially for the mood swing person. It has been seen here, the mood swing person means they are having hormone disbalance. Okay. So this disbalance also getting cured. Okay, how? Because usually whenever the stimulation occur, the glandular stimulations also occurring due to the increase of the blood circulation by the applications of the cupping therapy. So glandular secretion whenever becoming proper, then again the hormone secreting properly as well as the mood become established. That's why it's vigorously using for the depression cases, in case of the mood swing cases, even for the anxiety, stress and tension too. Next one is the skin diseases. Yes, skin diseases vigorously using, especially for the acne, boils, abscess, or any kind of even eczema, psoriasis. It also has been seen. It's working nicely, even in case of the cellulitis. Okay, because what happened? It has been told yet that all the toxic materials, it is actually lodging underneath the skin. So whenever we are giving this blood, wet cupping, then this usually those kind of toxic materials just removing out through this blood and all. Sometimes we are giving wet cupping also, but in that cases we have seen yet the entire toxic materials actually removing through the urinary channels and all. Okay. Now coming to the hair growth, definitely whenever the blood circulation increase, definitely it will help to give the proper nutrition and blood circulation towards the roots of the hair. So that's why in our science also is there, we are knowing that is the prachana karma. We are also doing now, after doing this prachana karma in Kerala also they are applying the kali mirchi powder. Okay, so it is also helping to growth of the hairs and all. So this is one kind of procedure. Same like the if we want to increase the blood circulation over that area, cupping is a good option. Okay. Next one is insomnia. Definitely, it's most of the cases it has been seen in the person who is already suffering from the stress, tension, anxiety. So if it is reducing by the applications of the as well as which is making it equilibrium conditions of the Bayu Prokop becoming equilibrium conditions. Most of the cases, patients sleeping quality also getting increased. So that's why insomniac patients also is working very nicely. Previously, 18th century, it has been seen yet in case of the mumps, in case of the cholera, and yellow fever, all the infective conditions were treated by cupping therapy very nicely. For the mumps also, they were using this wet cupping therapy over the swollen glands and all. And nowadays also, we are applying this one for the gastrointestinal disorder. It's also working very nicely for the habitual constipation because it is stimulating. It is stimulating the entire intestine, stomach, spleen. So the metabolism power also getting this because digestive juices, whenever the stomachs and all getting stimulated properly, then digestive juices also releasing properly. So automatic the metabolism power increasing and as well as the digestive problems also getting cured. Okay. Not only that, even diarrhea also, some type of irritable bowel syndrome that also can be treated by the cupping therapy. So most of the cases we are going for the gastrointestinal disorder for the dry cupping, not wet cupping, always dry cupping. Next one is coming to the urinary problems. Okay, urinary problems also it has been seen, it's also stimulating the the kidney, urinary bladder and all. So there's also the person who is having the dysuria problem or polyuria problem like that. For them also is working very nicely. Okay, so for that usually we are doing the dry cupping over the lumbar region. There we are putting the this cupping and we are actually performing. Okay, next one is the menstrual cramp. Definitely, whenever the other organs are getting benefited, then why uterus and ovaries will not be benefited, right? So in case of the gynecologically, it has been seen yet and proved yet even menstrual cramp. Okay, this time the dysmenorrheic patient, if they are performing in some periodic way, then they also will get relief because first of all, it's helping to give some equilibrium condition over these hormones as well as estrogen and progesterone hormones, as well as it's also helping to stimulate the entire uterus, ovary and related all the gynecological organs. So that's why it's also helpful for gynecological disorder too. Now coming to the methodology. During my PG, okay, in Alva Ayurved Medical College, there we have done one procedures by the help of the Sringa. Okay, so that's I'm going to show you. That is the Purva Karma. First, that is the cervical spondylosis case came for us. So we first cleaned that area by the help of the surgical spirit, and afterwards we just put this Sringa over which area we have already decided that area we should go for that. There we just first kept over there, and then by the using of this palm we just making one mark over that area. Okay, that is the just we are determining this area, okay, as the Purva Karma. Okay, afterwards, let's see, afterwards we just removing this Sringa again, just we had made this mark over there. Next portion, that is the Pradhana Karma. In case of Pradhana Karma, then we are starting to do the Prachana Karma. Actually, we should use the scalpel blade, 11 number scalpel blade. But that time it was not any problem, it was not available. So we made this blade properly sterilized, and afterwards we used it. Okay, but most of the cases I'm recommending 11 number scalpel blade we are using. Okay, so after making this areas entirely prachana or incision, after giving this incision, then we are once again we are placing this Sringa over that area, predetermined areas, and then we are going to start to pump. So from 0 to we have pumped up to the 15. Okay, this pressure is not standardized. This is because till now the research work is going on. The established research papers we have not got yet that would be the standard pressure we have to follow like that. But that time we have continuously asked the patient, are you feeling any uneasiness or feeling much more pain and all? Based on that we have done this pressure, we have given this pressure. Afterwards, completing this and training out the portions, then we are cleaning that area. Always keep in mind, same portions again and again, don't go for the Sringapacharana in one sitting. We may do it after 3 to 4 days later, but not on the same day. And as a Paschata Karma, usually we have to clean the areas, along with sometimes in modern and cupping therapies, those physicians, they are using actually the antibiotic creams and all. But as being Ayurvedic doctor, for the Madhu and Ghrita applications, because Madhu is having very good property of healing, Shodhan and Ropan property. So it's also helping for that. Okay. Now coming to the next one, that is the research reports. Yes, we got several research reports, especially that one also I got, that is the one research work actually conducted in Iran, okay, Sahid University. There it has been seen that more than 135 cases they have put this cupping therapy over them, and they got some biochemical and hematological, immunological factors improved very much. That's why their P value of the statistical value became very much significant. And based on that, it has been shown it there the cholesterol, triglyceride, LDL, all the points getting improved after the applications of the cupping therapy. So now coming to the latest modification of the cupping therapy that I have already told you, that is the laser therapy. Yes, nowadays laser therapy become gradually famous, for not famous, now becoming very much familiar towards the people, because first of all it's having less chance of scar mark, okay, less chance of hematoma. Okay, not only that, it's a very minimally invasive or non-invasive procedures. Okay, patients also feeling less uncomfortable. So that's why nowadays laser becoming much more familiar with the other person. But the matter is still now in market, we are still now searching if it is possible to get it. Definitely, we will inform the others also. They may purchase and they may use in their clinics and all. Now coming to the contraindications. So as the contraindications, there's usually that previously also I have told that in anemic cases or low blood pressure cases, usually we are avoiding, because already the person is having low blood pressure. So sometimes due to the vasovagal shock may occur. Sometimes it's possible they may suffer some other complications. So we are avoiding. And for the weak patients, that's also we are avoiding, because weak patients also neurogenic shock. Sometimes they are also getting. So we are avoiding. Post-surgical cases also patient become very much weaker. So that's why we are avoiding. And in case of some cancer patient who is already having some low platelet count and all, if the person is having the HIV, in case of the person who is having the already hepatitis B or C, like that. So in that cases also, we are not recommending. Even not only that, even the extremely high is for the pregnant woman too. So we are avoiding. Let's come into the side effects. Okay. So first I'm showing you one picture. Yes, that is Michael Phelps. I think so many people are knowing him as the very good famous swimmer in America. In 2016, he had performed very well in swimming. So now you just see his on the shoulder portions, there are some marks also showing. So this is actually cupping, after post cupping marks are there. That is nothing, just like the small hematoma form. So why they are doing that one? To mobilize their entire joints, portions, their extremities, so they may perform much more better during this competitions and all. But the problem is sometimes this hematoma also may pass is there. That's why the first one is just there will be some scar formations as a adverse effect, not the side effect. Better to say sometimes it is very not permanent. It is sometimes temporary. Some adverse effect may be seen yet. Burns. Why? Sometimes what happen whenever we are using cupping with the help of the fire, means fire cupping. When we are taking this gauze or this cotton, just smeared with the alcohol and ablazing, and afterwards then we just making this vacuum inside the cup. What happened? That time cup becoming little bit hot. So whenever we are applying over the skin, then that area, the surrounding edges, little bit becoming cauterized. So it's also very much less burn cases we have got yet. It is very much rare cases. Okay, so burns also may occur. Sometimes muscle tension, sometimes small hematoma I have told yet. Even some infections also may occur. It is also depending upon the sterility, how you are performing and where you are performing. In the dirty places, if you are going to start suddenly, then there is a chances of the infection. So first you have to make all instruments clean and sterilized. Afterwards, if you are performing, then there is no chances of further infections. Okay, and hyperpigmentation also there. Along with that, headache, sometimes the dizziness, anemia, nausea is also very common. And vasovagal attack that I already explained, that's also sometimes common. So I think today my topic is over, and if you are having any question, may I ask, and Sad, just you take over the rest of the part.
Thank you, Dr. Ganguly. It's a very nice presentation covering all the aspects of the Raktamokshana as well as in the topic. And even on the background of the Ayurveda or the Indian thought, that's the nice. So if anyone has a questions, they may ask. If anyone has a question. Yeah. That means you are so nicely and precisely presented, so each and everyone, everything has been understood by all the persons. That's why perhaps the remarks is coming on the chat box, the very nice interpretation. a nice speech, ma'am. So lots of compliment, yes, compliments is coming on. That means
Thank you.
each and every things has been understood by each and every one. So it's thank you, ma'am. Thank you.
Thank you so much.
Nice presentation. Already I'm sharing you this on your WhatsApp also. That's the
Thank you so
point.
much, sir. Thank you so much to give me this opportunity to present in this platform. Thank you so much.
We are also thankful to you.
Yes.